while we are discussing about the public health and hygiene, we have responsibility to save the society, and we have to await the society to save the public health. Airborne diseases. Airborne diseases means those disease causing microorganisms are transported by the air. The source of this disease is air. That's why these are called as the airborne diseases, especially the viral diseases. Most of the viral diseases are airborne diseases. In this discussion, these examples are COVID 19, influenza, whooping cough, and chickenpox are discussed here in this mainly airborne disease. Yeah, COVID. We know about the COVID-19 disease. Influenza is also common cold diseases. Whooping cough is actually this whooping cough is not in our society because every child is vaccinated with this whooping cough. And chickenpox is common disease. You at your boyhood stage or childhood stage in your school, you might have suffered with skin rashes. Chickenpox, that is common disease. Actually, at the severe condition, these are a very dangerous disease, airborne disease. They first of all, if we discuss about the COVID-19, there is no discussion because everyone aware about this in proper manner, because the COVID-19 is caused by the coronavirus SARS-CoV-2. This is look like a common cold, but it took many valuable lives from humans. Many were died throughout the world, accumulated throughout the world, shaken throughout the world, and this is mainly caused by the air from the deceased person that can transport it to the healthy person and caused everyone, not only the few people, everyone is suffered with this COVID-19 disease at that pandemic stage 2020 and 2021. But many of the persons who lost their lives due to the deficiency of immunity, but some are cured from the disease, escaped from the disease. Some are, however, not suffered with the disease symptoms. Of course, the virus might be entered into their body, but they were not suffered due to high immunity power. So this is COVID-19, but we wish that we do not come close to the COVID-19 once again in our future or future generations. That's why we have to follow some preventive methods. That is, all we are 2 times vaccinated. The vaccination worked only for 1 or 2 years. Hence, we have to take the vaccines. Everyone should take the vaccines every 1 year or 2 year as per the direction of health organizations. And wearing mask at the severe conditions, we have to wear the masks. Social distance at this accumulation, because this is airborne disease which can transmit from one to another easily through the air. That's why we have to maintain some social distance. Hand hygiene, ventilation, proper ventilation is very important, because in the dark rooms this virus can accumulate very easily. Staying home when sick, if you are suffering with this viral disease, you have to be stick to your home or room. You should not roam in the society. You should not no need to accumulate this disease to other persons. That's why we have to follow this some of the preventive methods. Influenza is a common cold. However, we should maintain some preventive methods. Whooping cough or pertussis is also transmitted by the airborne disease. That is a Bordetella pertussis, the bacterial disease, but we have to follow some preventive methods. In these preventive methods, especially the DPT vaccination, all the Indians are vaccinated at at their childhood stage or boyhood stage with this DPT vaccination. Below 5 years only, below 5 years, this DPT vaccination is completed. However, this whooping cough, no one children in our India, mostly 99%, no one child in our India are suffering with this whooping cough. But in another airborne disease is the chickenpox, that is also called as measles. that can transmit from one to another easily. If mostly in our schools, many of the children are suffering with this chickenpox disease that can transmit very easily through the books, through the pens, through the slates, or whatever it may be, through the air that can transmit very easily from one to another. Most of the children suffer with this chickenpox disease at their childhood or boyhood stage. But luckily, if once this chickenpox is attacked to the children, throughout their lifetime they do not suffer with this disease. They do not suffer with this disease again, because the immunity power is developed. Antibodies and memory cells are developed at the first attack, and they in the future they do not suffer with this disease, chickenpox. Once again, the preventive methods, actually this is airborne disease. In the schools especially, this is accumulating. Okay, however, if one child is suffering with this chickenpox disease, others should not be contact with them, and this is the one and only preventive method.